Okay, well, let's go ahead and get started. Hello, everyone. Welcome to Sustainable Jersey's 2021 Sustainability Summit panel on Get the Lead Out. I'm Melanie McDermott. I'm Senior Researcher at Sustainable Jersey, and I'm delighted to be here with you today. Before we get started, here are a few housekeeping notes. So all attendees are muted. I will note to panelists, you are not. So panelists, if you're not speaking, you can go ahead and mute yourselves. And if you do have questions, please go ahead as they occur to you and enter them in the Q&A box. You'll see at the bottom of your screen, you'll see the opportunity to click and enter questions. The chat is for everyone to see, and the Q&A is a good place to store questions for the panelists, because at the end of the presentations, we'll have time to delve into questions and hopefully have a little discussion. And at that time, you can use the control panel at the bottom to raise your hand, or we can read out your written questions, which you've noted in the Q&A box, or potentially the staff or chat box. We're fortunate to have Sustainable Jersey staff member Megan McParland providing tech support, and she'll be noting the chat and keeping us on track with our time tracking today. If you are calling in by telephone, please make sure you've entered the audio pin, because otherwise we won't be able to unmute you if you want to call in with a question or comment. Note that closed captioning is available, so look for the live transcript button in the control panel at the bottom. The event's being recorded, so this recording and the presentation will be posted to our website by May 28th. So with that, I have a few announcements. Note that June 6th, the municipal certification deadline is coming up, and June 21st will be the, so that's the first round for the municipalities, but on June 21st, the final school certification deadline is up. And we're so excited to be launching the Sustainable Jersey Gold Star Standard in Water today, and that Water Story Action, which is your entryway to the Gold Star and much else besides. There'll be free technical assistance, grants for free technical assistance available. See the link, and please attend the seminar, the webinar on tomorrow to learn more about that. We're also announcing $75,000 in grants for resiliency and environmental stewardship projects. For those municipalities in the Atlantic City Electric territory. So see the link to find out more about that. And before we get started, I wanted to take a moment to heartily thank our summit sponsors and our program underwriters. We couldn't be holding this event or doing the work we do without them. So thank you to all the organizations and businesses listed on this slide. I'm going to go ahead and introduce all of our speakers in advance, and we'll just flow from one to the other after that. So first up will be Elyse Pivnick from Isles, and she will be followed by Kelvin Boddy from the Housing and Community Development Network of New Jersey. And from there, we'll turn to Julia Taylor, who's with the Trenton Health Team. Then next up will be Chris Hellwig, who's the health officer over at Hamilton Township. And then we'll have a quick and exciting announcement from Jael Davis with Lead Free New Jersey. And then I will wrap up with a short piece before we turn to Q&A. So with that, without further ado, I'll hand it over to Elyse Pivnick from Isles for the first presentation.
Oops, and hi, everybody. Glad to be here today. Melanie asked me to talk about first why we should be caring about high lead levels in New Jersey, and also to introduce the new proposed sustainable New Jersey actions to help prevent lead poisoning. So very happy to be here. Oops. Huh, why am I not advancing? Okay. So just a little bit about ISLES, founded in 1981. We consider ourselves a community development and environmental organization. Our mission is to foster self-reliant families and healthy, sustainable communities. And in your free time, you can look at the small print here. It's our new graphic for ISLES. All right, so I always like to start out with this quote of the day. The photo in front of you, the person is of Dr. Mona Hanna Atisha, and I consider her the rock star pediatrician who first recognized that childhood lead levels in Flint children were going up after the change of water source. And she, around that time, was quoted in the New York Times, if you were going to put something in a population to keep them down for generations to come, it would be lead. So this is another quote that I think about, and it's by a Harvard researcher, Dr. Robert Sampson, he's a sociologist, who's done a lot of work on lead, and that lead toxicity is a pathway through which racial inequality literally gets into the body. So I invite you to ponder these over time. I always like to share this advertisement and this coloring book, really, of Dutch boy paint from the early part of the 20th century. And what's important to know is that that everyone's having fun applying their lead paint. See, it's a really great thing to do, and you have a coloring book for your children, and you want to encourage that family to use lead paint. And what's important to know is that lead in paint made the paint more water resistant and easier to apply. It was considered a premium paint. At the bottom of your screen, you can see the note here that paint also robs a child of their potential in life if they ingest even the tiniest amounts. Oops. So lead poisoning remains the #1 environmental threat to the health of America's children, as well as a health risk for people of all ages. It's so toxic, it's unsafe at any level. So a very important thing to all understand is that lead exposure is cumulative. So if a doctor tells a child at their 1-year-old visit that they don't have a problem, that doesn't mean they can just stop getting tested. They've got to the doctor needs to continue to test, and because lead builds up over time in our bodies. That goes for adults too. So anyway, so the main sources of paint are of lead are old lead paint, water, which we've heard a lot about, and of course soil. So how much lead dust should we care about? And here's a kind of a pretty strong graphic that shows that the amount of lead dust that fits in a sugar packet, if you spread it around 100 rooms that are 10 feet by 10 feet, you could start the poisoning of a child. It's really a tiny, tiny amount. We've heard, probably everyone here has heard a lot about adverse childhood experiences. And the top of the tree you see are, the ones that are part of that body of work: divorce, mental illness, homelessness, violence, substance abuse, etc. And then at the bottom, you see adverse community environments, and you see poor housing quality and affordability to the right. If I were been part of this original conversation, I would have been speaking up very strongly that lead poisoning is a childhood experience, and it's a social determinant of health, and that it should be part of this conversation. So whenever I have an opportunity, I add that to the conversation. So what's important to know 80% of New Jersey housing was built before 1978. That's when lead was removed from new house paint. In 2019, about 4,000 new children in New Jersey had a lead level of 5 or greater. And by the way, 5 or greater is a political number. It's not based on science. There is no safe level of lead in a child's body, period, end of sentence. So over 225,000 children have been poisoned since the year 2000. 36% of inner city Black children versus 4% of suburban white children have been affected by lead. And a thing that I continue to find very frustrating is that lead seems to be forgotten in child development. There's like a firewall between what we know about lead in our education department and the like. There was, maybe many of you know about my brother's keeper program during the end of the Obama administration, where there was an effort to develop a set of programs or bring together resources to increase male minority achievement. On the first day I looked at that study, I went right to the control find to see where they talked about lead poisoning, and I was stunned that lead poisoning was not even mentioned. And if you are interested in male minority achievement, you would be well versed to have that in your arsenal. And we'll talk about this later. One of the things we know is that lead disproportionately affects the male brain compared to the female brain. Oops, get these all in here. So what's important to know here, this kind of puts the meat on the bones of what happens to a child. So a child's long-term memory is compromised. A student cannot, they've learned their multiplication tables on Monday, they wake up on Tuesday and it's gone. They have trouble hearing the difference between S's and Sam and F's and Frank. So that impedes their ability to read. Just think about how a child will feel in a classroom where they can't succeed and they don't even know why. So the inability to control behavior, and the most poignant characteristic here is inability to learn no matter how hard that child tries. So how is that child going to be behaving in the classroom? Chances are they're going to be behavior problems, acting out, they're not happy with themselves. So you have disruption in classrooms by children frustrated by the failure to learn, lower test scores for individuals and entire school districts, and then again, disproportionate number of low-income males incarcerated and unemployed and aimless compared to white counterparts and even compared to females. So they're more likely to misbehave in school, 7 times more likely to be suspended from school, 10 times more likely to end up in juvenile detention. And there's clearly an interconnection with poverty as well. So other sources of lead, we talked about paint, water, that, I think the connection between lead and water is widely understood. And we continue to be frustrated by the fact that lead in paint is less widely understood by the public. Probably everyone here, I'm singing to the choir, but so it's in cultural items, toys, etc. Whoops, I think, okay. So Sustainable New Jersey can help prevent lead poisoning, and their new action is encouraging housing code enforcement. All right, so we are suggesting here that there be healthy homes training for housing and health inspectors. So ISLES has been running a New Jersey Healthy Homes Training Center where we provide training. There's there's a new national resource for that as well. We are funded by the Department of Health, and we can provide that training for free. And you want to empower inspectors to inspect whenever they are in a home. So when you go into a home to do a plumbing inspection or something else, an inspector has the power to enforce their housing code, the municipalities and housing code. There is no housing code in America that says it's okay to have peeling and chipping paint or any kind of condition that would poison a child. We just need to find the ways to enforce our housing codes. All right. And we also are suggesting leave behind a healthy homes checklist. And you can see here's a sample of one from the National Center for Healthy Housing that is excellent. Oops, I'm sorry, my screen's going very slow. Oh. So we are also saying, let's create a culture of lead poisoning prevention in all city operations. All right, so every place, anyone who works with children, anyone who's working in housing, and social service agencies everywhere should be trained in the principles of lead poisoning prevention and healthy homes. And we want to train mayors, council members, school superintendents, school boards, child study teams, community health workers, faith and civic leaders, New Jersey elected officials, and more. And I've kind of, part humorously put the pictures of the mayors from the 5 cities that had the highest incidence of lead poisoning or high leads in the latest report that was published for 2019. And that's West Orange, East Orange, Atlantic City, Irvington, and Trenton. So I argue if we got all of those people to take our healthy homes training, they would have a much stronger sense of urgency about trying to coordinate resources and get something done here. So we want to create a lead and healthy homes advisory committee in each municipality in New Jersey, especially in high risk areas. There is so much to coordinate, and code enforcement, making better use of community health workers, doing a better job of reporting and sharing data. What are we doing about our Section 8 program? How is it that we allow Section 8 landlords to be approved for Section 8 and not test their homes for lead? There's Medicaid ideas that we want to bring in the education sector, make sure that our child study teams are trained in lead. There's a lot of legislation we want to see happen. And we want to bring in the world of energy efficiency to lead poisoning prevention as well. So the call to action here is we want to see equity. All children should proceed through life unburdened by lead. And we wholeheartedly support the proposed new sustainable New Jersey actions. Thank you very much. You're welcome to contact me, put a question into the chat, and I look forward to hearing from my other speakers.
Okay, I believe that segues into me now. Let's see it.
Actually, the next up we have Julia Taylor
Oh, I
from the.
apologize.
That's all right.
Oh, I'm sorry. Sorry, everybody. I thought the order was got switched up with the introductions. Okay, let me.
Glad I'm not the only one.
Yeah, sorry, Kelvin. We'll get it figured out here, folks. Let's see. This is. Should be good here in just a second. Okay, everybody should see now the Trenton Health Team screen. Are we good?
Yes, we are.
Okay, awesome. Well, thanks everybody for being here. I only have a few minutes, and for those of you who know me, and I know there are some people in the audience who do know me, I could talk about this stuff all day. So I will be as quick and brief as possible. But first, I just want to say that, thanks to Elyse for her comments. I've been working with her for more than 12 years, and her advocacy is really one of the major reasons why I'm so passionate about this issue and about fighting against lead poisoning. I want to begin and end with the two key points. This is a humongous equity issue. And by not being able to identify at the ground level what's going on, we can't solve it. So you can't define a problem, you can't solve it. And so that's what I want to talk mostly about today. So very quickly, I'm with the Trenton Health Team. We are based in Trenton. We are one of 4 regional health hubs in the state. And I'm not going to go through all of this information, but it's here on the slide. So if anybody wants to check it out later, you're more than welcome to. We are focused on the health and wellness of the Trenton community broadly. And a couple things I want to focus on for how we function is that we have the Health Information Exchange for the Trenton region, which is an electronic medical records aggregator So we have millions of records for hundreds of thousands of patients coming in from thousands of providers. We also get Medicaid claims data. And the tool that runs the health information exchange has a population level analysis module. So we're in a unique position to have really granular data about our community and to find interesting ways to access it and share it with other data. But also obviously with this many medical records, we're operating in a very secure environment. So one thing we're really looking forward to is figuring out how we can use our unique access to data to achieve our vision for healthy Trenton. And again, I'm not going to read through all of this, but what it tells you is that from our beginning in 2006 as a conversation where we focused on how do we bring healthcare providers together and how do we do a better job of treating the needs of the highest utilizers, we've really switched from that that focus to a much more upstream social determinants approach where we see that all of this is interconnected and we can't really address one thing without thinking about how it affects everything else. And in order to do that and to achieve the vision we've laid out for the way we want to approach serving our community, one of the key things that we want to do is make sure we're a resource both internally for our colleagues and externally for all of our partners on data and analytics. Because again, if you can't identify and define the problems, you can't really solve them very well. And if you can't test the effectiveness of your interventions, then you can't figure out the kind of impact you're having. So that's a huge focus for us. So I wanted to give you just a couple examples of the way that we are working with various partners on data projects, not all of them related to healthy homes or lead, but I think this will give you a sense of the range of work that we've been doing, the kinds of partners we've been bringing to the table. And again, focusing on doing this all the right way. So strict data sharing agreements, making sure we're adhering to HIPAA or FERPA or other requirements. And I won't get into all the names of those acronyms, but suffice to say, those are the regulations that say like, hey, you want to do stuff with data, cool, but you have to do it safely and you have to protect people's privacy. So that is fundamental to how we operate. And over the past year, we've developed an internal data capacity. Actually, my colleagues are listening in today. So if you have questions for me, they may be the better ones to answer later on. But we want to make sure we can give the broadest picture of what's happening in our community, not just to us internally, but again, to our partners. We coordinate the Trenton Region Community Advisory Board, which as of right now has about 100 organizations represented, about 200 individuals. And we have had several of our partners come to us and say, hey, can you help us work on this issue or that issue? So one of our key roles as a regional health hub is to create a community health needs assessment. Ours was last released in 2019, and we called it a community health needs and assets assessment so that we could focus not just on the needs, but on what are the strengths that help to support our approaches to the work. Right now, we are working on a community, and I see, sorry, I've got a typo in my slide. I will fix that later. The community health needs assessment we are working on with our local hospital partners and with the Greater Mercer Public Health Partnership. At the same time, we're working with the Henry J. Austin Health Center, which is the only federally qualified health center in Trenton. We're working with them on their community needs assessment. So trying to make sure that housing issues, healthy housing issues, lead issues are represented in all of these compendiums of data about the region so that this becomes part of the conversation on a regular basis and we can think about what are the appropriate interventions. We're also working with Mercer Street Friends, the regional food bank, to think about the food system big picture and work with their network of pantries to analyze how they are serving people and how they can better meet the needs of the community. And right now we're partnering with the Trenton Board of Education on an All Kids Thrive project that's funded by the Princeton Area Community Foundation to identify students with chronic absenteeism that also have health issues that may be causing that chronic absenteeism. So that project was specifically intended to focus on healthy homes issues. The theory going into the project when we began 3 years ago was that we would find several children with asthma in particular, and that those tough asthma days were the days they were missing school. We certainly are seeing some of that in the data, but we're also seeing lots of other issues. So this ability to share data across sectors again, in a secure and protected environment, is shedding a lot of light on what our community members need to be healthy and safe, you know, in their schoolwork, in their communities, whatever it is that they're doing. And then the other thing we started to do, again, the health information exchange is on one side primarily for medical providers so that they can see records for their patients across any of the other providers that feed into the health information exchange. But at the same time, because we have all of that information from the medical encounters and also from the Medicaid claims data, we can start to see the prevalence of specific conditions within the community. I do just want to say sort of quickly, when we do this kind of work, we can't really say that this is the prevalence of any specific condition in Trenton, because we do not have every single Trenton resident in the database, but we do have a lot of them. So it's not the same as saying, you know, there are X people with diabetes in Trenton, it's X people among the population represented in the HIE. But we are right now working on specifically looking at diabetes, asthma, and lead poisoning. And diabetes and asthma are slightly more straightforward than lead. I'll get to that in a second. But one thing we're learning is that when we go this direction, sort of looking into the health information exchange and trying to find prevalence of conditions, it's more difficult than if we have a set population to look into the HIE and see what we can find out about them. And I'm saying it this way because right now we don't know who has lead poisoning in Trenton, so we can't go into the HIE and see what's happening with them. We are working on all sorts of different ways to figure out how many diagnosis codes, for example, are in the health information exchange that might mean that somebody has lead poisoning, or which lab results say that somebody has an elevated blood lead level. It's proving difficult, but I think that it's as important to go through these steps and be able to document what doesn't work so that we can make the case for what might work. And I'll talk about that in a second. And let me just make sure, are you all seeing this slide that says THT data work? A few examples?
Yes.
Okay, good. Thank you. I thought I saw something get out of whack on my screen. Okay, so one of the reasons I'm here today is because I've been working with Melanie and lots of these partners that are at this presentation to think about how do we use the sustainable Jersey mechanism to encourage better cross-departmental data sharing within municipalities, and also better cross-sector data sharing between municipalities, between state agencies and municipalities. So coming up, just like Elyse was talking about a new lead action, there will be a new Sustainable Jersey action released soon that encourages municipalities to find ways to look across their departments and figure out how do we link data so that we can be more intentional about figuring out what our problems are and what the appropriate interventions would be to solve them. And I do think it's really important as municipalities do this work internally, which is, you know, I know how challenging that can be. So that's sort of one step, but at the same time, thinking about what other data sources might feed into a municipal data set, database that would give a better understanding of on the ground conditions. So the key thrust of this action, and something we've been talking a lot about, is encouraging municipalities to link data by property, by address. So what we see a lot, and again, I want to stress, I know that things happen differently in different municipalities. There's not really, it's not like you can say, well, do this data sharing and then it'll be the same for across the state. That's clearly not the case with the number of municipalities we have. But in many places, for instance, housing inspections happen in one department, health inspections happen in another. And so in the case of lead, for example, municipalities or other health departments that are working on lead poisoning cases, they're working in a state database called Lead Tracks that, as far as I am aware, does not connect in with municipal data sources. And so that means that if a landlord is, if a property is owned by a landlord and in that property children are getting poisoned, it may be the case that the housing inspectors are also having issues with that landlord, but those departments aren't talking. And so there's not coordinated effort to identify which property owners are either enabling. In some cases, that's great. We don't hear as much about that, but either enabling or hindering healthy and safe housing. And what I want to argue for is operationalizing an investigative mindset. So not stopping, we found a child with an elevated blood lead level. We're going to deal with that landlord and deal with that property because that's what the protocol is. We need to go beyond that to say, well, what else can we learn? What other buildings does that property owner have? When were they built? What condition are they in? Have they had recent code violations? Like, do we think that those homes have had healthy homes assessments, and where could we find out if they have had those or not? In presentations like this, it's starting to become sort of a standard, and I think it's important that we keep saying this. Kids should not be the canaries in the coal mine. We cannot wait to solve this problem by finding out when a kid has been poisoned by lead. It's not acceptable it's not acceptable, and we need to stop it. But what we often find is that the data sources aren't there to help us be proactive. So one example that I want to raise, and I understand there are a lot of challenges with this, is the lead tracks database, which is run by the State Department of Health. And it is, the way it's operated is in state statute. But think about how, if we could change how that information is collected and protected at the state level, how that could support municipal data sharing and stronger healthy homes protections. So, for example, if we were able to find a way to share that lead tracks data within municipalities, then different kinds of inspectors could think about different kinds of interventions with landlords. Or if we could think about pilot programs, like if we could get lead tracks linked up with the Health Information Exchange, for example, we could do so much work on the ground to figure out who are the children that are getting missed, they're not getting the appropriate screenings. Where are the lead cases, and how do we see if there are clusters, if there are property owners we should be going after? There's just a lot of different ways that we can be more proactive and, again, keep these kids from being canaries in the coal mines. There are always barriers to this. There's always a privacy barrier, a data sharing barrier. So we need to identify what those are and then find ways to enable proactive interventions based on the data. We can solve these problems. These are not insurmountable. We can protect patient privacy while also making sure that we can keep kids safe. So again, no one size fits all answers, but the more we try, the more we'll learn, and we can share across our municipalities with our state agency partners and thinking about how we might be able to move this ahead. And again, I want to just leave you with this note that this is an equity issue. We can't continue to have our primarily low-income communities in our primarily communities of color bear the burden of lead and the lifetime of impacts that it results in. So I'm looking forward to what these new Sustainable Jersey actions might be able to encourage, a lot that we can learn from across our municipalities and across sectors. And I appreciate the opportunity to be here with you all today, and I'm happy to take questions later on. Thank you.
And now over to Chris Hellwig from Hamilton Township. Thanks so much, Julia.
Good afternoon, everyone, and I apologize, my microphone is not the greatest, so if I cut out, somebody just yell at me or type it in the chat that you can't hear me. So I'm going to build on what both Elyse and Julia kind of laid the groundwork for in regard to what lead is, why it's an important issue, and kind of talk about the municipal health perspective. So I am the health officer for Hamilton Township in Mercer County. And we have our own division of health here, which allows us to get, more kind of boots on the ground and really into the community, because we have our own health department rather than, some communities who either have a shared service with another municipality or are covered by, let's say, a county agency who might not be in the community as often as we are on a day-to-day basis. So we've already kind of touched on this, but when we talk about health and specifically the health of our residents, we kind of want to look at the idea of social determinants of health, and this idea of your zip code can pretty much try align with how long you're going to live, how well you live, what opportunities you have access to, which is not great. We shouldn't be able to, pinpoint kind of and map out your life just based on what zip code that you're currently living in. And it's really up to, especially, looking at the local health department, the municipality, and the residents to really try to take those areas of concern and trying to address them to make it a more equitable and better living environment for everyone that's there. And when we talk about lead, lead crosses over a lot of these different categories and really has a huge impact on especially our young children, how if they are exposed to lead as a child, how they can possibly what their outcomes and what their future can turn into. And that's kind of what this, the idea of environmental justice brings about. And I like the definition from the EPA, which is, environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. So in Hamilton, we are a large municipality. We are also both geographically and population size as well. So our residents that live along the Trenton border, especially once they look very same style housing, same a very similar population, and kind of housing stock, educational opportunities, all of those demographics. But then as you get it further out, it becomes more spread out, not necessarily rural anymore, but at one point it was a more rural area as you move further away from Trenton. And there's even though lead can be an issue in both of those areas, we know that the burden is a lot higher in our neighborhoods and our zip codes and our communities along the Trenton border, just because of the housing stock and the access to both be able to remediate lead, and also it's a more we have more tenants and we have to deal with more landlords, where as you move further out, it's more single family homes that are newer built, and the exposure to lead becomes less. So municipalities and local health departments are really on the front lines of making a difference in environmental justice, and really making sure that our residents have the opportunity to move on and to kind of address some of these issues within their community. We've already talked a little bit about where the sources of lead come from. Mainly here in New Jersey, the vast majority of our cases of elevated blood lead levels, so that's what you'll see EBLL throughout the presentations, that's elevated blood lead level, are really coming from lead-based paint. The vast majority of our housing stock in New Jersey is older, just as our infrastructure. We are in an older state in regards to our infrastructure. So we do have a lot of lead-based paint and lead-based dust in the community. And that's really where our children are being exposed to lead, is through the inhalation or ingestion of lead from lead dust. And that, if you live in an older home and you have not, and you look at your door jambs or your window sills, and you still have, wooden window sills or wooden windows, that friction and those friction surfaces create a dust that over time will build up in the home, especially if, either the resident or the property owner is not maintaining those pieces of, equipment in the home, or doing regular cleaning. You can live safely in a house that has lead-based paint. It's just you need to constantly making sure that it's maintained, or that lead-safe procedures are taken. So whether that is putting a sealant on the lead paint to reduce the dust from coming off of the paint, repainting, making sure that if there's any cracks or chipping or peeling, that it's taken care of, or eventually replacing some of those friction surfaces with newer materials to make sure that and removing the lead from the home. We have had lead here, in the New Jersey water system, what we tend to have is not necessarily what we saw in Flint, where it was a system-wide water issue, where in New Jersey, it's more targeted, where it's really the lead service lines from the water main going into the homes, and some of the fixtures in the home of the lead leaching out of the, whether it's a lead service line or let's say a faucet or solder, and leaching into the water as it, the water is not, is too acidic and it causes that leaching. So that's why it's so important to make sure, especially if you live in a home that has older piping, or you're unsure of whether or not you have a lead service line, that's something that you can talk with your water utility to find out about. And there are starting to be more and more programs to allow homeowners or property owners to replace those lead service lines along with the water utility. That's why water flushing is so important. But we also know that we have a large immigrant population here in New Jersey, and that does bring in some of the cultural products, whether that is different makeup, jewelry, toys, spices, pottery that can be brought in from overseas or their place of origin, and those can be leaded as well. If you are eating off of or drinking out of a pottery or plates or dishware that has lead in it, eventually that will leach out into the food or the liquid that you're drinking. I can be a source for the children to get exposed to. And we've already gone over this as far as effects of lead goes, but there is no safe level of lead, period. But the good news is that lead poisoning is 100% preventable. In New Jersey, New Jersey is a special place, so we are a home rule state. There are currently 104 local health departments in New Jersey that service all 565 municipalities in the state. And this is made up of county-based health departments, such as Burlington County is the only health department within Burlington County, and they service all of their municipalities, or municipal-based health departments like Hamilton, where we service the Township of Hamilton and only the Township of Hamilton. But then there's other, different ways that you can be serviced by another township or commission or some other forms of health departments here in New Jersey. But the thing to remember is the true power of public health rests in the local board of health in New Jersey. Each municipality in New Jersey has a board of health. And that is usually the town council. But some towns and some municipalities have autonomous boards of health, such as Princeton. Princeton has an autonomous board of health that is able to make laws, ordinances, and enforce public health rules. And then some have an advisory board of health, which is a separate group from the town council, but they're only there as an advisory role. And there's four, in Hamilton, our town council acts simultaneously as our board of health, which is the most common form here in New Jersey. And local boards of health / local health departments by proxy are in charge of emergency response and disaster resiliency, community disease investigation and outbreak response, such as COVID, environmental health inspections and investigations, which is leads right into lead, which we'll discuss, and chronic disease prevention and health promotion. And if you are unsure of who your local health department is, the Office of Local Public Health at NJPOH does have an up-to-date list of all of the health departments in New Jersey and what townships they cover, and the link is right there for you to access that if you need to. So what is the role of the local health department? So and specifically in regards to lead. So our authority is given to us specifically under the Title 8, Chapter 51, childhood elevated blood levels, and then also there's 51A, which covers the screening of children for elevated blood levels. And our three main areas of involvement come in the form of screening for elevated blood levels in children under the age of 6, conducting nursing case management, and then also environmental interventions. So in regards to screening, in New Jersey, all children ages 12 and 24 months are required to be screened for lead. We know that doesn't happen, and I would say, I believe, I don't have the correct numbers, but it's less than half of all children in the state are actually getting the screen at those intervals. So there is a disconnect between who is getting screened and who is not getting screened. I believe Elyse covered that earlier on as well. But also, in addition, all children aged 6 months to 72 months are also required to have a risk assessment performed when they're in front of the pediatrician, or if we have a childhood health clinic here at the health department, and we do that assessment here for those who have no insurance or are underinsured and they come to our clinic. We perform those risk assessments to see, do they live in or reside or frequently visit a house that was built before 1960 or before 1978? What is the condition of the house that's in? Is there peeling paint? Is there chipping paint? Does the primary caregiver or the guardian work in an occupation that might expose them to lead, such as one of the construction trades? Or do they have hobbies where they might be using materials that contain lead? So especially if you're in a rural area, that somebody who might make their own bullets, that might be something that might put them at high risk because of lead exposure that way. And really, all healthcare facilities that service children under 6 years of age, or local health departments / the Board of Health, are able to perform the screening or refer them to, and they really should be doing the screening. So as you're part of your green team, or you're looking for opportunities of where your municipality can start making a difference, it's really trying to get our rates of getting children under the age of 6 screened for lead and the blood lead level up. And that would be able to identify the children who need our assistance the most and put them into nursing case management, which is the next case or the next part of what we do. So each child who has a blood level that is confirmed with 5 micrograms per deciliter or higher, which is the current rate of where we get involved, they get assigned a nurse case manager, and they go into the home, do a case home visit, provide education and counseling, and do the coordination of care between the guardian and also the child's primary care provider. The best practice is also, once the nursing case management starts, is to also do an environmental intervention, which is where our inspectors come in and it really helps to identify the source of lead and hopefully remove that lead from the child, or the child from the lead, and the lead from the home, because we do want to get, if need be, we temporarily have the family relocated and then hopefully put back into their home, which is either made lead safe or lead free. While our inspectors are also in there, this is a great opportunity for our inspectors to also identify other potentially hazardous conditions and really making sure that if there is another issue that doesn't fall within the realm of the health department, that we're making those referrals to the construction house, or the construction department, the plumbing code, or the plumbing inspector, the electrical inspector, or worst comes to worst, if we need to make referrals to, let's say, DIFUS or another child protection agency, to make sure that the children are as protected and the family is as protected as possible.
Chris, just so you're aware, you only have about a minute left.
Yep, I'm wrapping up now.
No problem.
So that's everything. I know I kind of ran through that, but I'll be available for questions. But I would be remiss to throw in here, I know this is lead, but we are still dealing with COVID-19, and I encourage everyone, if you have not been vaccinated already, get vaccinated. All 3 vaccines are safe, effective, and available. And if you do not know where to get one, contact your local health department. They will get you vaccinated. If you've been vaccinated, find someone who hasn't and get them vaccinated. And there's my contact information. If you have any other questions, you can type them onto the end.
Thanks so much, Chris. And now we turn to Kelvin from the Housing Community Development Network of New Jersey for his presentation.
All right. I'm actually supposed to be on the screen now, so I'm happy to be here. Happy that everybody is here as well. I would like to, before I will start sharing my screen now, but at this point, just kind of the little bit of housekeeping that I did have here. I did want to say I'm very happy that you know, heard the analogy a bit earlier that we can't be using children as canaries in the coal mine, if you will. And here at the network, the way we say it is basically we cannot afford to use our children as lead detectors. We're at that stage where, especially with the nature of the issue that lead is and the effects being permanent in some cases, it's really not an issue where we can afford to be reactive and kind of chasing the smoke to see where the fire is. We need more preventative measures. And I know Elyse and I believe Julia were also speaking a bit earlier too. A lot of it is a housing code issue, especially in regards to lead paint within properties, and how do we find a way of enforcing these housing codes. So at the network, being primarily an advocacy organization of about over 250 kind of nonprofits, CDCs, professional institutions, financial institutions, and the like, we primarily like to advocate for affordable housing, economic opportunities, and healthy homes and communities. As it relates to lead, we currently have two pieces of legislation that we really consider priorities in going forward to mitigate the risk that families and children face within homes. And the first of which is Bill S1147, with the primary sponsors being seen here. And what that would require municipalities in essence to do is lead paint inspections prior to home purchases and tenant turnovers for rental units. This we feel is a very important piece of preventative legislation, especially in regards to it doesn't wait around to see if there's an issue within a property, especially when a new family moves into it by waiting, God forbid, to see if the kid has exposed blood levels. Instead, it would just eliminate the risk before the family itself moves in. And it also could create sort of a buffer zone between tenants that normally, if they moved into a property that did have lead paint within it, they might seek reprisal by the landlord in some form, whether official or unofficial, in pointing out the issue. This just cuts that out completely, cuts out any kind of difficulties that might be faced with a property developer, a realtor, what have you, and makes that a requirement just first and foremost. And it also establishes educational programs on lead paint poisoning. And we feel that, this in itself is really the other one as well, but this in itself is a huge one, as I was speaking about the preventative measures that we need to see in this state. We cannot afford to use our children as lead detectors and then kind of as the other speakers were alluding to, use them to kind of pinpoint where the problem is and then work reactively when the damage has in many cases already just been done irreversibly to the people exposed. And the second bill is S1282, and this would require inspections every 5 years for single family and two family rental units. So this tries to get around the issue of the first bill. Some might say, okay, well, if it's only during turnover, how do we address the rental units where people are already living and might be staying in extended durations? So this would be handled in-house by the municipality. They would charge a fee for the inspection, and it would also impose an additional $20 fee per unit for the Lead Hazard Assistance Fund. And I did neglect to mention in the last slide, but S1147 is currently in the Senate Budget Appropriations Committee. So it's moving along there. And then this current bill, S1282, is currently in the Assembly Housing Committee and the Senate Community and Urban Affairs Committee. Almost messed that one up. So generally, there is no safe level of lead for children. That has been said multiple times, so I won't really kind of circle back to that too much. But these two pieces of legislation are really tools that we feel that municipalities do need to enforce their housing codes. It'd be extremely beneficial. We urge everybody here to call their representatives and the sponsors of these bills and urge the passing of them. We cannot afford, as I was saying earlier, to use our children as lead detectors. And this bill eliminates much of the risk that comes with lead paint usually being the highest source of lead exposure in and around a property, and also make sure that we're not using those kids and their families as kind of the alarm bells when we realize there's a problem. This is a little bit shorter compared to everybody else's time slots. I really just wanted to cover these two. However, I did want to say that these bills will be a priority at our Legislative Day event that is coming up on June 2nd. Among others, that is where members and attendees get a chance to speak to their representatives, have meetings one-on-one kind of with their districts, and advocate for policy priorities as it stands to their communities and themselves. the two bills that I just mentioned, S1147 and S1282, will be priority bills at that event. As well, I will be dropping in the chat box links to our website, our lead exposure page in particular, which has a variety of resources on the kind of sources of exposure in lead, where it tends to affect New Jersey at least the greatest. And that page also contains resources that can be used for clients and communities in directing them to the proper kind of organizations or authorities if there's questions about how do I find lead exposure, what do I do once I've found it. And additionally, I will also be dropping a link for our policy priorities, which does contain these two bills, among others, as they relate to healthy homes and lead. Again, I know this wasn't the longest speaking slot compared to everybody else, but as an advocacy organization, these, and as it relates to lead, these are the two pieces of legislation that we really feel need to continue to move along through the legislative process, and we ask for everybody here's support in moving them forward. And I will also drop the names of the bills in the chat box as well, because I know that's kind of did a rapid fire, a lot of things in a few minutes.
Thanks so much, Kelvin. You really did cover a lot. We're grateful for that. And now we have, we'll turn things over to Jael Davis from New Jersey Future and also Lead Free New Jersey.
Thanks, Melanie. Thank you so much for having me here. Great hearing all of the prior presentations. I'm going to share my screen quickly and just let you know about a new effort that is in place to address the lead issue in New Jersey. So I'm the program manager for Lead Free New Jersey, which is a new collaborative. And I just wanted to share a little bit about it and give you all some information about how to join if you may be interested. So we heard from several of the other speakers about lead, about a lot of research that has been done around this and about what we need to do to make a change, right? So we all understand that there's no safe level of lead, and we understand that the best way to prevent lead exposure is to remediate the lead from the sources. So we think that the best way to do that is to build a collaborative campaign of interested parties that are trying to advance policies that will result in children that are free from lead poisoning and in a lead-safe environment. So that includes practitioners, policy advocates, environmental organizations, municipalities, community members, and even health and medical professionals and child care professionals as well. So the purpose of Lead Free New Jersey is to ensure that New Jersey's children are free from lead poisoning and that the environment is lead safe by advocating for changes to state and local policy. And I know Elyse talked a lot about the fact that this is an equity issue, as well as all of the other presenters really. But we understand that this is an equity issue and that it affects low-income communities and communities of color. And this collaborative makes an effort to really include those communities as a part of creating solutions. So our primary goals are holistic lead remediation, so removing lead from the sources within 10 years. It focuses on policy change and empowered communities. So communities where people understand the effects of lead and have the resources to really self-advocate as it relates to lead policy. So we're working with some grassroots organizations in 3 communities, Trenton, York, and Patterson. And locally, they'll work on coordinating efforts, educating their communities, and strategizing on solutions and advocating locally. So I know that we have several Green Team members here on the call, and I think that it would be great to plug in and work collaboratively with these organizations as they're looking at solutions to lead issues locally, and also joining the statewide collaborative, which would give you an opportunity to weigh in on the direction that Lead Free New Jersey takes to learn more about lead and learn more about policies that are in place that would address these issues. And, just to work with a community of other individuals that are interested in getting lead out of our environment and our children being safe and creating sustainable communities that are free from lead. So I will include the link to sign up in the chat. Here's also my information and the email address for Anthony Diaz, who's our community outreach coordinator, and you're welcome to reach out to either of us if you have more questions. Our next membership meeting is upcoming in July, and there will be more information about that. We also have a website that will launch next week, so I will be happy to share that with Melanie, and maybe she can get that to others once that's available. And that's all for me. Thank you.
Thanks so much, Jael. Thanks to all of our panelists. And I'm going to wrap today and leave some time for your questions and hopefully for a little discussion at the end. So hopefully you are now seeing my screen. I'm sure everyone who's on the call who wasn't already convinced is now super eager and charged up to figure out what their green teams, what their municipalities and schools can do to tackle this problem, and that they clearly see that it's a sustainability problem, it's an environmental problem, it's an equity problem. I put the schools in brackets. The focus of our presentation today is on our municipal program, but I look forward to working with the schools program, and our municipal actions will really highlight the really critical role that schools can play as part of this collaborative effort. Schools have the most direct contact with our child population, regardless of its immigration status. So that's a really important area we look to getting into. But I want to point out that already in the Sustainable Jersey program, we have several actions that can really make a difference in reducing lead, the burden of toxic lead in our communities. We have a fairly new removing lead from drinking water action. We have a private well testing action. We have a tobacco-free community action because turns out that tobacco is lead laden, and so tobacco smoke is a health risk that can bring lead contamination. We have a lead outreach and education program action that we will be upgrading and adding to, so look for that. But what we're most excited about is a new slate of actions, which you've heard about today, that will be released towards the end of July. Elyse made mention of the comprehensive lead strategy action, which will draw on all that great data that health and housing departments and other departments will be sharing via the lead housing hazard and housing hazard data sharing action, which Julia touched on. And Elyse at the beginning made that connection between a healthy home and reducing lead and other contaminants together. And that action, an action that will go far to address that, will be the Healthy Homes Training and Inspection action. There's a fourth action that no one else has mentioned yet today that I'd like to just flag. And that action may be posted within the next few weeks, in fact, ahead of the others. That's a lead screening campaign, which is outreach and education specifically targeted at increasing the percentage of children who have had that state mandated blood level screening test that Chris spoke to, and really get those rates up. Municipalities can do a lot here, and schools can partner with them to get more of the required tests for children done at the appropriate age and get them caught later if they enter school without having had their mandated tests. So municipalities can do coordinated outreach. They can hold or collaborate in holding free screenings and get points for that. They can do direct outreach to pediatricians and other care providers and get points for that. They can do targeted outreach in the neighborhoods most affected by lead poisoning. So all of those things are going to be part of the upcoming lead screening campaign action. And I'll just close by saying that this whole suite of actions is evidence and a way to implement, to practically implement Sustainable Jersey's commitment to advancing social equity as a key part of what it means to be sustainable. And we're making the connection that sustainable communities are healthy communities, and healthy communities are not laden with toxic lead. So all of that is going to be integrated in our new Gold Star standard in health, which will be released by the end of July. And so we hope you are all convinced and all on board with underlining the fact that healthy homes are integral to healthy communities, and healthy communities is what Sustainable Jersey is all about. Just want to quickly point to the fact that there is a whole, a host of upcoming events all this week that you can still register for in our Sustainability Summit. Especially, you might be interested in our session on the new gold standard in health forthcoming. That will be Thursday at 1. That Go for the Gold session. Please register for that if you haven't already. And this recording and all the presentations will be posted by May 28th. So we can look forward to sharing that, because this was a really, really rich session. I know I learned a lot. If you want to follow up with me, here's my email and the Sustainable Jersey contact email. And now we have a little bit of time left for some questions. So let's see, I'm going to stop sharing my screen so we can all be together. And we did have one question that was entered in the Q&A, but I want to invite participants to raise their hand with that little icon down there at the bottom of your control panel if you'd like to be unmuted and ask your question directly. And we'll also look through the chat to see if anyone has entered a question in the chat. But I am going to ask all panelists to unmute themselves because you guys are the experts. So for example, the question that was entered in the Q&A from Vicki Benetti, it says, please clarify the responsibility of pediatricians in getting children screened and doing lead risk assessment. I was wondering, Chris, if you wanted to take that question.
Yeah, it's actually spelled out right in NJAC 851A, specifically 2.1 and 2.2, and it's every physician, registered professional nurse, as appropriate or healthcare facility that provides healthcare services to a child who's at least 6 months of age, but less than 72 months of age shall, and then it's do all the stuff for the hazard assessment and the same thing, the schedule for the lead screening. So if you want to check it out, I'll put the link to the code chapter in there so you can see it, but it's pretty specifically spelled out that it shall be happening, but we know that they do not always do that. So education outreach. So if you are in a municipality that has especially pediatricians' offices or big practices, this might be a great opportunity to do some outreach or partner with your health department to do some outreach to those facilities to just remind them that this should be occurring, regardless of where the child lives. So they do not have to be connected. So that's the other important stuff.
So I could just add a little bit here, which is the data tells us that Medicaid children typically do get both tests. But what the data also shows us, and the Department of Health did an analysis that showed that children in suburban practices, that you often had a pediatrician who said, oh, the first test was fine. I don't have to, I'm not going to bother with the second one. And the Department of Health did an intervention a couple of years ago where they sent letters to people and they said your license is basically could be threatened if you don't give that second test. So it's something to watch for. It's very, it's not uncommon for people to think, oh, that problem belongs to them over there. It's not my client base. And we know that that is not true. We know that lead is found in the richest communities and the poorest communities.
Yeah, thanks, Elyse. And that I'd like to point out that lead screening campaign action that I referred to, one of the things that towns can do for points and to make a difference is to communicate with, for example, by sending an annual letter or a regular letter to all the pediatricians and healthcare providers, reminding them of that responsibility of testing the kids. That's one thing that some local health departments and municipalities have done. So there's an opportunity, for municipalities to step up and make a difference there. I did note that someone also had a fairly technical question in the chat that came from John Wheeler, who happens to be on well water. He's in Cape May County. And he had a recent test that showed water with lead above the federal action level. And he asked, what do I do now? Wondering, Chris, if you might or others might want to speak to that.
So I think the best option would make sure that you have filters, water filters placed on your, the faucets or anything that you're drinking out of, and make sure that they're certified to remove lead, because not all water filtration systems remove lead. Some just do particulate matter, but you want to make out for that. And then really, I guess it would be, that's hard, because if it's actually within, I guess, and I don't know if this is a bigger conversation, is do you know if the lead is actually in the well water, or is it in your water plumbing system? Because those would be two different things. One, I mean, they're both not great options, but that would be the other thing to try to identify, is if you can identify the source of the lead. But that's something that I would reach out to your the Cape May County Health Department, and they could probably provide you further guidance with what direction to go.
Thanks, Chris. Last couple of minutes here. I don't see any other questions in the chat or any hands raised, but I did want to take these last few minutes to thank our panelists wholeheartedly, and to really emphasize to everyone on the call that this is a collaborative effort, and Sustainable Jersey can do a lot, but our municipalities could do more. For example, if some of the legislation that Kelvin spoke to was passed, this is why we're really emphasizing partnership here, and with our public health community. Everyone is needed for this, and we look forward to working with you together and launching this exciting new slate of Sustainable Jersey actions in lead and health and housing. Together we can do this. So with that, I'll thank everyone, and I'll look forward to seeing you on some other sessions.